Good afternoon, everyone. This is the Board of Health meeting. It's a virtual meeting. Today is Thursday, January 14th, 2021 at 4 p.m. My name is Thomas Corey. We have Michael Coughlin with us, Tess Curran, agent of the board. We do have some guests. At this moment, Dr. Gagliardi has not yet arrived. Pursuant to the open meeting law, any person may make an audio or video recording of this public meeting or may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived by those present, and are deemed acknowledged and permissible. Normally, the next order of business would be to accept the minutes of the meeting held on December 3rd. Unfortunately, Dr. Gagliardi is not here to second them. So unless there is objection, we will move those to the next meeting.
And Tom, I'll just do a roll call to start things off.
Okay.
Thomas Corey.
Present.
Michael Coughlin.
Present.
Hello.
And
Dr. Gagliardi is joining us.
How you doing?
And Dr. Gagliardi.
Hey.
Okay. Since Dr. Gagliardi has arrived, we will reverse that. We need approval of the minutes from the meeting of December 3rd, 2020. Are there any additions, deletions, or corrections to be made to the minutes of the meeting as printed?
No.
Dr. Gagliardi, I need you to make the motion.
Motion to accept.
I'll second the motion. Can we have a roll call?
Thomas Corey.
Yes.
Michael Coughlin.
I abstain. I did not attend the meeting.
And Stephen Gagliardi.
Accept.
Okay. Next item of business is the review of the proposed keeping of animals regulations. They were distributed. A final updated copy was in the last day or so. Has everyone had an opportunity to read through those?
Yeah.
Are there any? I only have one question today. Under the hearings, which is page 7 on the new edition, under hearings, B, notice of the public hearing relative to, my only question is, it says the applicant shall submit a list of abutters certified by the Fall River Board of Assessors with a variance request and a sworn statement that the applicant has mailed notice to each abutter by first-class mail. Are we able to provide a sample notice to the applicant? Otherwise, that way there'll be some uniformity throughout the system.
I'll defer to Faust or Lisa. Would we be able to create? I would think we would be able to create a template.
Certainly. My best guess is that we'd go to the assessor's office and see what kinds of things are going out. I don't think it'd be difficult to come up with something like that. That could actually be in the package that someone gets when they apply.
Okay.
Oops, we lost our light. We're on a motion detector. There we go.
That's the only question I had. The rest of it looks fine. It looks, it's in accordance with the discussion we've had last month and the month before.
I just had a quick question in general. It says the abutter is any property within 300 feet. How about like a chicken coop? Does that have to be a certain distance away from another person's house or the property line? I was looking for that. Or does it matter? As long as someone gets a permit, then, because some properties are pretty small in Fall River. Mine, mine's big, but not everybody has.
Well, I think we had this discussion last month or the first week, because in my particular case where I live, there are probably, I think I counted 17 abutters under the 300-foot rule. And I remember you had said that in your neighborhood that wouldn't be a problem.
Yeah. Now I'm talking about the actual chicken coop. Does that have to be a certain distance from
Property line.
someone else?
Yeah.
In the old days, it was 50 feet from any dwelling or property line. I'm not sure if that's mentioned here in this regulation.
Don't
I
believe,
lost you there. All right, I'm back. My phone went dead.
I don't believe we have that 50 feet. Because right now, that's where we're having the so many people coming in for the variances for the 50 feet. So we can certainly,
It would be, may I comment?
of course,
Yes,
It would
Fausto.
be difficult, would it not, to require that if someone had a 75-foot lot?
Yeah.
Well, that, in the past, as I remember, the regulation was it had to be 50 feet from any dwelling or property line. And if they could not make that 50 feet, that's when they would come in for a variance and the board would get involved.
Right, so our discussion last, I mean, I don't know what we haven't seen a draft of this, so I'm kind of shooting in the dark here, but I don't know if this is addressed in your draft here, but one of the issues is so what was happening is if they don't have that 50 feet, they go for a variance. Right now, if they get a variance, they will almost always put the coop on the property line. When I had chickens, I put mine on the property line. I mean, that might be, from our perspective, I think that dovetails with what Dr. Gagliardi's might be saying here, is that where is the chicken coop once they get the variance? And I mention that because that does cause neighbor complaints, such that if you have a big yard, you got to put it 50 feet away, but you don't need the variance. But if you need the variance, there's no requirement that you try to keep it away from your property line.
I mean, at first, there aren't many properties in Fall River that have 50 feet from any other property line.
Right.
So that would mean you'd have to have 100 foot.
Well,
I
it's
mean,
50 feet. The regulation is 50 feet from any property line and or dwelling. So if you had a 100-foot lot and you had a house in the middle, it's also 50 feet from the back of the house to the back of the property line. So you need
Yeah, so I
100
don't know,
feet
man, I don't-
back.
You can head up Highland Ave, you're not going to find too many houses like that. So pretty much everyone has to get a variance,
Correct.
essentially. So just say get a variance. I mean, because nobody qualifies. Hardly. Maybe out on Meridian Street.
Right.
I don't
So
know.
our concern last time was that in majority of cases, there is no setback requirement because it is per variance. That variance is because it's a small lot, and in the past, there's been no setback requirement made by the variance. So that people with a small lot will invariably put that chicken coop on the property line. And that has caused complaints to us. We received complaints about that. I don't think the public is aware that if you have a big yard, you have to keep it in the middle of the yard. They're just saying, well, why does it have to be right on my property line? And it is allowed right now, right? Again,
Well, my
I'm
only
kinda
point is
shooting in the dark.
if everyone has to go for a variance and then everyone gets a variance, it seems kind of like, a circular loop. Why go through the process? If 98% of people, based on the lot plan in the city have to get a variance because they're not going to fill the 50-foot requirement, but then they go for a variance and 98% of people get the variance, it seems like kind of a pointless exercise. You know what I'm saying? I know that's the way government works, but maybe it's my
Right, so
first day.
our concern was that, well, twofold. One is that the ordinance itself doesn't really address that. It just says if you don't have the setback, you go for the variance. And the variance doesn't really spell out too much. So we can't help people that complain, in other words. People that complain about their neighbor having their chicken coop on the fence line, we can't help them with that. And that goes along with the fact that in the other case, if you don't need the variance, you don't need the rodent control, yet rodents are known to travel more than 100 feet. So our concern was, how do we enforce the variance that we have? Because right now, it's very difficult to help anyone with any problem. So I mean, I think, could you say something where it has to be I don't know, the furthest distance away from property? See, that wouldn't work though, right, Mr. Corey? Because the furthest distance from your neighbors might put the chicken coop right next to the owner's house. Right? Because right now,
Theoretically, yes.
yeah. Of course,
Yeah, most of the lots, and you know, and on my, you know, little Delcar Street there, have about, you know, 10, 15 feet around the perimeter of the house. I mean, so there's no way most people are going to make that kind of requirement. And anybody who's going to have a chicken coop, I mean, you're going to put it on the property line, you're right, because you're not going to stick it in the middle of your yard, because then
Right.
you essentially give up the use of the yard. Because there's a chicken coop in the middle of it.
right. So we don't have an opinion on where it should be. We're just trying to relay what the concerns of neighbors have been to us, and, you know, what we can and cannot do to try to allay those concerns.
Well, I
And
think,
it's not So what?
so I think this regulation would then require everybody who has anyone who wants to keep chickens, that they would have to get this permit that would then require them to have, pest control and a written and documented plan of maintaining their chicken coop, and all of that.
Okay.
So that may help, because now we only have that for the people who are, requesting a variance, but this would, like we had talked about before, even the playing field for all, residents who want to have chickens. They have to have a permit, which then requires pest
That would-
control and basically all the things that we have for a written management plan for manure management, store and feed, pest management, and
Yeah, I think people's complaints generally revolve around people not following those rules. Either the smell or rats or things like that. So that's when people aren't doing what they're supposed to do.
Right, but this sounds like a big improvement
The
because,
complaints really aren't related to where the chicken coop is. You can put a chicken coop on the property line as long as, you keep it clean and do what you're supposed to do.
right, so that would be an improvement, and maybe the only practical one. Again, I don't know what your draft says, so I didn't know that was in there. That would certainly help if they had to have some management program for the manure, the droppings, because that has been an issue as well. Right there on your property line, but if they have to have a plan for that, then that certainly would help.
Yeah, and that would help with enforcement because there are written rules in place, and if people, aren't doing that, that's the cause of the complaint in the beginning.
Yeah, certainly would. Now, can I ask another question?
Of course.
Is there, so the other big problem we have in enforcement is roosters. So that when a variance is granted, roosters are prohibited, but it has not been in the ordinance. And even if it were, without a penalty, it would be difficult. It'd be difficult to, so probably the most frequent complaint we have is about roosters. And right now, there's not much we can do about it except tell people to get rid of the rooster. But we can't fine them to encourage them to do that. And generally speaking, in this office, fines tend to be sort of a last resort, and they're quickly forgiven if compliance is reached. I know no one likes a fine. We don't really necessarily like assessing them, but the vast majority of the fines that we do in minimum housing, for instance, I dismiss one way or another because the property owner comes in compliance. But it does give us a little bit of leverage to say, well, you got to get rid of your rooster, assuming that's what you want, but we just assume that you do because when you grant the variance, you don't want the rooster. But right now, when we tell them, and they will ask for the ordinance, we'll say, well, you can't have a rooster. And they say, well, show me why I can't. If they're doing this without variance, then
yeah, and Faust, roosters, So the document that we're going over was we had sent it, I guess, originally back when we had our first discussion. So it's pretty much similar to that
Okay.
kind of format, which prohibits roosters. And then in terms of penalties for, violations of the permit, the board can suspend, revoke, or deny if a permit holder is found to be in violation of any of the provisions of this regulations after a hearing, and that arrangements for rehoming the animals shall accompany any suspension or denial of a permit, and that the permit holder shall be responsible for rehoming arrangements and expenses.
All right, so the board would potentially, they'd make the decision to revoke the license. And if they don't get rid of the chickens, people love their chickens. So if the board says, okay, no more chickens.
I mean,
and they
what's
don't
wrong
get
with
rid
a
of the
fine?
chickens-
I don't see what's wrong with a fine. If you're breaking the rules and you get a fine, just like, if you're going down the highway at 110, you're gonna get a fine.
There also is fines. So the fines would be $50 for the first violation, $100 for second violation, and $150 for the third and any subsequent violation. Each day the violation continues shall be considered a separate offense.
So does that happen once the board has said no more chickens? Or, well, I suppose we can work out the details of enforcement another time, but certainly sounds like an improvement.
Well, I would assume patient gets a permit for 12 chickens. And everything goes along fine. And all of a sudden a rooster shows up and we get a call from one neighbor and a call from a second neighbor. And one of the inspectors would have to go out. And if there's a rooster there, the board for many, many years, as I've been on it, we've tried to do it pro education. And the inspectors would go out and they'd say, listen, you're not supposed to have the rooster. We're going to give you 7 days to get rid of the rooster. And if the rooster is still there at the end of 7 days, I think that's when we would start to apply fines.
Yeah, that sounds reasonable.
But the board has always been, we tried in the tobacco situation and other situations, we tried to educate the public first before fining.
All right, typically we will, and I'm talking more of the minimum housing side, but we're all in the same room. What we typically might do is, in one form or another, we issue a warning letter before we assess a fine. That's a
Mhm.
standard operating procedure here. We very rarely would issue a fine without a written warning, giving them a certain time frame. And if that's spelled out in the ordinance, we'll do it that way. If it's not, we probably would give them more than 7 days.
Well, that sort of escalating enforcement is pretty standard in public health practice, Faust. I
Yeah.
think that's a good practice to use. The verbal warning, written warning, then move on to fines.
Yeah, that seems pretty reasonable.
All right, then. I think that the only other question I have, and this would be something you might want to take up later because it applies to everything that Lisa does. Lisa is our sanitation inspector now. I don't know if you all know that our other sanitation inspector transferred to another department. And she's doing a great job, but she's one person. And in general, she issues many licenses, as you know. And most licenses, most license issuing departments here and entities do have at their disposal another tool that's a late fee. Try to get people to, get their paperwork in on time and do what they need to do. There's never been one, I guess, one in the sanitation inspector's realm. And that's something that you might want to look at for this if you want, but maybe in general, what would be a late fee to encourage people to, honestly, what it means is a lot more work for the inspector to chase these people around. And again, without that leverage, without that penalty that they might be facing to get what they need to get done. And so the licensing, is always a scramble, end of the year, beginning of the year, but it tends to go out a little bit longer in this case, because there isn't that incentive for people to, fulfill whatever requirements there are. I know that every year some restaurants get assessed a late fee because, you know, they haven't sent their check in or whatever that is. And that's even tough sometimes to get people, you know, you don't want to shut a business down, right? Over something like that. But you do want, they're supposed to be licensed in a timely manner. So we're hoping that perhaps you'd consider that. I don't, maybe too late to put it into this one, but maybe a general late fee. And again, we take every effort to avoid that. We call them, we warn them. It's not about collecting money. It's simply about keeping the operation efficient.
And Faust, do you happen to know what the late fee dollar amount is for the food? I don't know that off the top of my head.
No,
Yeah, it's
I believe it's
$60.
$60. That's-
60?
Yeah.
Yeah.
Would the board like to add a late fee to this regulation?
I would have no objection.
Yeah, that sounds okay.
Sure.
Okay, then I will plan to add that to let's see, the permit and application requirements section.
Mhm.
With falling in line with the other late fees, we could do a $60 late fee. Okay. Okay.
So we're sending this back for one more revision with the
So,
late
yeah.
fee?
Yep, so I can add the late fee. Otherwise, if there's nothing else, and I could just make sure that we would have a template for the
Applicants.
applicants.
Yeah, we'll get that for you probably by early next week.
Okay. So I can edit this and send it out to all the members of the board for review. Do you want to have another meeting prior to moving forward on a public hearing to go over it one more time, or with me adding the $60 late fee and confirming a template, would we like to move forward at our next meeting to hold a public hearing to then potentially vote on this?
I'm
I think if
comfortable with that.
Yeah, that sounds good.
Okay. Okay, well then we'll plan for that. I'll just have to make sure I have enough lead time to put the notifications out. Okay.
Okay, moving on. Is there anything of such a nature under new business that could not make the agenda?
So I just wanted to take some time to talk about COVID, and you know, I'd love for Mr. Coughlin to also contribute to this conversation. I'm also on a timer here, as he is currently working with DPH, doing a lot of work surrounding all things coronavirus. So as of this afternoon, I'm just trying to get our case counts. Our case counts here in Fall River were at 9,907 cases, with a total death count of 253 deaths. So unfortunately, we have had 3 additional deaths today. We are underway with our vaccination planning, and this week we have started our vaccination clinics for our Fall River first responders. We've vaccinated probably about 80 individuals this week, and we are signing on to continue to vaccinate through all of the phases. So Fall River has agreed and will be working with the state to roll out additional clinics for all of those who meet the current requirements, to be vaccinated. We're following the timeline that the Department of Public Health vaccine advisory panel has put in place, and right now we're in that kind of third bullet of phase one. Next week, congregate care and shelters begins. Then following that will be home health aides, and then non-COVID facing healthcare workers. And then we move on to phase two, and then phase three is the general population. So that's kind of where we're at. But if Mr. Coughlin, if you have anything you'd like to contribute or add, or we can have a discussion about COVID.
Sure. Thanks, Tess. I paid a quick visit to the first responder clinic over at BCC on Monday, and it was very well organized. So kudos to Tess and the others you work with to pull that together. This has been a challenge. I got called back from retirement from DPH to help them in the COVID response, and my role has been to work with local boards of health, and it's been an incredible challenge. I'm sure you've discussed this in previous meetings, but Tess and her colleagues have been under tremendous pressure. The vaccine rollout is just the most recent thing that's been on their plate. The local boards have been responsible for enforcing all of the restrictions that we're familiar with businesses, and the nursing staff and the boards have been contact tracing the thousands of people who've tested positive over the last 10 months, and they've done a tremendous job in Fall River and elsewhere. It's been interesting to me to sit in my home office here in Fall River and assist people all over the state in responding to this. We're all, to supplement what the local clinics that Tess was talking about are doing. We'll be standing up mass vaccination sites. You probably saw in the press this week that the first big one is going to be at Gillette Stadium, not that far from here, and there'll be six or eight of them strategically placed all around the state. You'll see those up and running within the next couple of weeks. So I don't know what else you would like me to add. I'm certainly ready to be a resource as we go forward with this. Tess and I talk about this stuff all the time, and I'll certainly be continuing to do that too.
Thank you.
We recently, I had told Tess about this and the guys at the hospital. We recently, I started up a lab. It took a little while, but we got our PCR testing in, and DPH just approved that a couple of weeks ago. So I get a small allocation, only a couple of hundred a month, but we get results in less than 2 hours. So I don't have to send it out. So we were reserving that a lot for people having surgery, because a lot of times getting a test 5 days before surgery isn't as useful. But now with surgery slowing down, we do have a little bit of capacity for people who can't wait a long period of time for their test. And I did get an email about getting vaccinations in the office and doing them here for our patients. So we were kind of starting to look into the logistics of that. It's not a huge thing, but it'd take some of the load off. I do have, some space in the building, and we could always get a little staff to help with that too. So even if we do a couple hundred a day, take the edge off some other places.
Yeah, Doctor, the success of this is to find as many locations as possible who can participate in the vaccinating, spread it out as widely as we can. So that would be great if you're able to do that.
Yeah, we're going to give it a try.
And on that note, or the testing, since you mentioned that, Dr. Gagliardi, there is going to be a new vendor here in Fall River for the Stop the Spread campaign, which is the state kind of coordinated free testing for all residents, whether they have asymptomatic or symptomatic. And they are going to be fully operational next week. That schedule is live on the MDPH website or mass.gov/stop-the-spread. And they will be up at Bristol Community College. It is going to be an appointment-based testing location, and it is a self-administered test. But I believe actually the group that's coming in is also coordinating the vaccination clinic at Gillette Stadium, or is working with them, the CIC Health. So, they have so far been a great, person or group to work with. And I think they'll really hit the ground running starting next week.
You know what testing system they're going to be using?
I don't. I believe it's the state, and maybe Mike, if you could chime in, but the state has always done, I believe, the PCR test, so I believe it will still continue to be a PCR test using the Broad Institute as a lab, is my understanding. I don't know specifically what brand of the test it is, but I can certainly find out.
Yeah, as long as is it PCR, is it Avid molecular, or is it real PCR? That's the.
I'll have to get confirmation.
Lost in the translation sometimes.
Yeah, I'm not 100% sure, so I'll take that back and reach out to my contact at CIC Health.
And how are people gonna be? How are they gonna find out about that? Is that gonna be out there?
Yeah, so kind of just was their appointment calendar just went live. So it is being posted on the city website. It was posted today. We're posting it on our social media channels and a number of listservs in the community, or sending it out. The mayor's office has been sending it out that way. And through the Stop the Spread website, where people have been going for the hours of the Star and Seven Hills, they'll be able to now see that CIC Health, and that will be the only vendor starting Saturday moving forward, because Star and Seven Hills, their operations will end tomorrow.
Is the fire department still going?
They are still going. However, that's not the free. So the free testing for residents will be that up at BCC with the CIC Health as part of the Stop the Spread initiative.
Okay. The other thing, and we had talked about this. I don't know if you guys can see out my window. The lively basketball game going outside with the 15 kids in close contact without masks. I don't know if this is, again, we've talked about this so many times. With the way things are, I mean, that was banned in March and April during the spring when cases were significantly lower. Now, we're running around with a 15 to 20% positive rate, 4,000 people dying a day, and we got kids playing basketball. We talked about this with the mayor. It doesn't make a whole lot of sense to me.
Yeah, basketball definitely has been identified as, a high risk sport. It does have kind of, for leagues, it's certainly, there are standards in place that we're required, any league is required to follow. Those unfortunately don't apply to the pickup courts. If the board wanted to consider to remove the courts, I think that would potentially be something that we'd have the power to do. If the board had made a decision to do that.
Anybody have thoughts on that?
Well, the only existing order that could be enforced based on what you just described, Ms. Doctor, would be the masking order, and I suppose a police officer or an inspector could visit the court every so often and remind the kids playing that they should wear a mask when they play. that's the only current order. But as Tess said, our board does have the authority to have the rims removed from the backboards. Could do that.
How did
I
we
know
do it how did we do it in the spring? They weren't allowed to play. How did we do that?
I had requested that the court, the hoops, come down in the spring.
I don't think many communities are doing that,
No.
but we do have the authority to do it.
You know, as a kind of, if as we're transitioning, I can, or if we would like to see if this could work, I can make the request again to the police department, and provide them with more masks if they're able to, if they see a group, you know, playing on the courts, that they could go out and like had said, if they could, you know, hand them the masks.
Yeah,
I don't.
yeah.
What was that, Mike? Sorry. So
It
that
just seems
could be-
contradictory to what was going on back in the spring. And, you know, now we know a lot more. You know, I think the last study came out, 55% of people who are positive are asymptomatic, and that's how it spreads everywhere. Not everybody is laying around with a fever, giving it to everybody else. It's the people who are fine. And these kids clearly, you know, are asymptomatic. And if it's truly 15% positivity in the population, you got 20 kids there, you know, there's going to be 2 or 3 that are positive playing the game. Everybody gets infected and everybody goes home, and then you've just infected 20 households. So
from the contact
I mean,
tracing end, we haven't, that's kind of a difficult one to target in a sense. We have seen, you know, outbreaks with leagues or other sports. That's a little bit more, it's a little bit easier to do contact tracing with a league. Right. Versus a pickup game. So
Right.
While we don't know of any outbreaks on a pickup basketball game, you know, it is difficult for us on the contact tracing level to make that determination.
Right. In the organized leagues, you have a roster you can work off of. For the pickup games, obviously you don't. So you have to rely on.
Yeah, we wouldn't contact trace it, but at the same time, the reason you do that for the leagues is because you know there's a high risk of spread. So then the idea is, well, if you're not in the league, then just, you know,
yeah,
we just let it go. All right, you know, well, they might spread it, but it just doesn't make any sense.
I hear what you're saying. I
mean, just nobody wants to make the call.
It could be. I don't have any statistics I can give you, but I haven't heard of anybody doing that. You're right. It was very common in the spring. A lot of communities took the hoops down, took the rims down, but I'm not hearing that much of that is going on now. That doesn't mean that we can't.
I know the mayor doesn't want it. He doesn't want to do it.
I would think that he would not want to do it.
All right. Hopefully the vaccine catches up to everybody. I'm vaccinated, so I got my second dose. I'm good. I don't know about everybody else.
Good for you. I'm going to be at the end of the line.
I checked my antibodies today. I had a nice pink line.
Well, to kind of circle just back on that, in the meantime, you know, I will readdress the basketball courts with the police chief, and try and make the request again for folks to officers who see, you know, groups playing basketball, if they could approach them and provide them with a mask.
As soon as the cops leave, the kids aren't going to wear them.
Unfortunately, I think you're right.
So just because we can't contact trace it and we don't know, doesn't mean it's not happening.
Yeah, definitely. Yeah.
But
There could be outbreaks.
logically, it's clearly an obvious place where they would be spread.
Yeah, it's a high risk, even if it's outdoors, it's a really
And you
high
can't-
risk.
You can't sit at a bar, but I can take 100 people and go play basketball.
Well, that shouldn't be allowed. The largest the game should be is 10. Because then it would be outdoor gatherings on private property. Well, no, like 25. The current public setting gathering limit is 25. That's enough
All right.
kids. Yeah.
But as soon as March rolls around, there's going to be 50 to 75 kids on that court.
Yeah.
Because you got the two games playing, and you got everybody around it, and all the kids at the end, all sitting against the fence, side by side. I'm just saying.
Okay.
And that's every court in the city.
I can contact the agency that oversees the sports restrictions and see. I mean, I haven't heard of communities banning it, but maybe they have. I can check with them.
I mean, it's not as big a deal now. It is January. I mean,
Right.
usually there's not a lot of basketball going on. But once March and April rolls around.
No, I hear you. I am just trying to assess the pros and cons, but I hear you and don't disagree with anything you've said, Doctor.
All right.
I believe maybe in the fall, I thought that I had heard that Framingham and Cambridge had pulled hoops. But I don't have an update, so I don't know whether they had, put them back up or if they're still down. So I can circle back with those departments as well.
I mean, the normal procedure is to take the nets down, and I think by November, December anyway. The nets aren't up in the winter normally.
Right.
So even in a normal situation, the nets aren't up. So now we have an abnormal situation and we have the nets up.
Well, it's certainly, if you'd like to, take action, the board certainly has the ability to do that. If in the meantime, if the board wants to consider taking action, like I said, I can readdress the issue with the police department and then reassess at our next meeting if it seems to be continuing. But it's
All right, I guess
ultimately the board's
keep
decision.
an eye on it. Kind of the horses out of the barn on that one, I think. But I think in the spring it's going to be a thing.
Yeah, and things we can things will look. Who knows what the spring is gonna look like? Unfortunately, but yeah, the options on the table for the board to make a decision. So, at any time, if that's something that is of interest, then we can address that.
All right.
Is there anything, Tess, under citizens' input?
No citizens input.
Okay, next would be to confirm the date for the next meeting. Following the patent, it would be February 11th.
Could we maybe do it the following week?
The 18th?
Yes, I'm just, with the workflow I have, I'm just a little concerned about making sure I have enough time to get the notices out for the public hearing. So if I could just have one more week, that might just cushion it a little bit.
Any objection? Does February 18th work for everyone?
Sure.
Sounds good.
Okay,
We'll plan for the same time.
yes. Tess, how do we do a public meeting via Zoom? I'm not, this would be a new
Sure.
experience.
So that's part of what I'm gonna have to work through those details, which is why I could use a little bit more time, but I believe that the process will be the same in terms of the notification, and then people would be able to submit written comment. I don't know that we would be required to have people present on Zoom, although I think we could set that up. So I'll just have to find out from the city clerk. I think it could be both, possibly people join the link. It would be like a live link that the community could join. And then they'd also be able to provide the written comment that I could then read on their behalf.
Okay.
So I'll just make sure we're buttoned up there and following all the protocols.
Very good. Gentlemen, motion to adjourn?
Second.
Motion to adjourn.
Second? Can we have a
Second.
roll call?
Thomas Corey,
Yes.
Michael Coughlin,
Yes.
Stephen Gagliardi.
Yes.
Everyone, thank you very much for your time this afternoon.
All right.
Thank
See
you.
you later.
Hey, take
Yeah.
care.